Dr. Chris Mansi, how are you today?
Very well, thanks. Delighted to be here, Chris.
Thank you so much for joining us. You, of course, are the co-founder and the CEO of Viz.ai, and such a wonderful company that's doing so many wonderful things. We honored you in our AI article, in which we really tried to focus on companies that realize that AI doesn't need to be a destructive thing, doesn't need to be a scary thing. There's so much out there nowadays about how AI is going to take over the world, AI is going to, take away jobs, AI is going to destroy humanity. But we focused on companies that really understand that it can be used to help humanity, it can be used to improve our lives in so many ways. And you are doing that in an extraordinary way. Um, my my mother had a stroke about 10 years ago and really suffered an enormous amount of damage because of it. And I learned so much afterwards about what really still needed to be done to understand strokes, to treat strokes, so that a lot of that can be prevented. And your company is doing so much along those lines, as well as with other healthcare issues. Why don't you tell our viewers a little bit about what Viz.ai does and what you do and why it's so important?
Absolutely, I'd be delighted to. First of all, sorry about your mother. Stroke is a devastating disease. I'm a neurosurgeon by background and founded Viz out of Stanford in 2016. With the initial use case was to help patients who are having a stroke. We use AI to identify patients faster and get them to the right specialist so they can get the treatment. We know in multiple diseases that leave you either disabled or can kill you, there's often a very effective treatment if the patient gets to the right place and to the right specialist in time. This can be in a stroke, this can be with a brain aneurysm, it can be with some sort of heart abnormality. These diseases left untreated leave patients disabled or dead, right? But if there's a effective treatment, the patient can walk out of the hospital and essentially lead a normal life afterwards. This is certainly the case in stroke, where there's a very effective surgical treatment called mechanical thrombectomy, and there's a medical treatment called TPA that dissolves the clot. But it has to happen within a certain time frame because we know that every minute of delay leads to 2 million brain cells dying, which translates to approximately 1 week of extra disability.
Mm.
Today in healthcare, what happens, the patient comes into a hospital. Often it's not the specialist hospital where the neurosurgeons and the neurointerventionists are working. It can be a more remote community hospital, even a city hospital, but they don't happen to have that specialist expertise in-house. And so the patient needs to get a scan, needs to go into a radiologist work queue. The radiologist needs to read that scan, communicate with several different doctors to get the patient to the right neurologist, and then transferred for treatment. We know that prior to this was all taking between 3 and 5 hours, which, given every
Wow.
minute is 2
Yeah.
million brain cells, is far too long. What Viz does is it uses artificial intelligence to automatically read the scan, whether it's a brain scan to detect a stroke or a heart scan to detect cardiomyopathy, and will alert across the entire hospital system the patient to the right specialist who's best qualified to diagnose and treat that patient. This reduces the time to treatment dramatically by over an hour in stroke and by weeks in many other diseases. This means that the patient's got a better chance of getting that life-saving or limb-saving treatment and leads to better outcomes, which is, why Viz has been adopted by so many health systems. We're in around 1,400 now across the United States. And also why CMS recognized us with a reimbursement via the NTAP program.
So essentially, there'd be really no practical way to do this without AI, correct?
Well, so the way we do it without AI is an ED physician and a radiologist would work together to diagnose the patient and pick up the phone and call the neurosurgeon in the other hospital. Right. But you can imagine that the ED physician, many of whom are my friends, have multiple diseases that they're caring for. There's the
Yeah.
social diseases, right? There's heart attacks, the strokes, there's trauma. And so they're not dealing with strokes every single day. And so they don't necessarily have that level of expertise that you would see in a comprehensive stroke center where the neurologist and neurointerventionalist, that's all they do, right? They treat these all day, every day. And so really there's a matching problem in healthcare, right? We have the treatments, but so few patients are getting access to the treatments. In stroke before Viz, it was about 2% of patients were getting a thrombectomy, right? And that's gone up dramatically since then. I think we'll look back on this time in 20 years and think, how was it that we had all this amazing technological innovation, both
Mm.
on the medical device and the pharmaceutical world? Like, we can treat a lot of diseases, but how was it that so few patients were getting those treatments in an effective manner? And Viz is here to solve that. Our mission is to increase access to life-saving treatments and use AI to route those patients to the right place.
And again, one of the reasons we liked what you guys do so much and featured you in this article is it's such a perfect example of how this isn't about replacing a healthcare worker. This isn't about replacing, not having the doctor use his knowledge and experience. This is really just a logistical issue, right? I mean, it's being able to get to that healthcare worker and get to that doctor, the right doctor, quicker, right?
Yes. Right patient, right doctor, right time. You do that and you get better patient outcomes. You get more efficient healthcare, right? So the hospitals do better financially. The payers who are paying for healthcare do better because the patient's less disabled. So everybody wins.
And I mean, how long has this been used now? How long have you been using this in hospitals?
Yeah, so we were the first company, talking about AI, we were the first company to receive an indication for approval from the FDA. That was in 2018. So it's been in hospital systems since, mid to late 2018. So that's 4 or 5 years now. So it's still relatively new.
Feedback from doctors, patients, how is that?
Yeah, well, the most important thing is patience, right? So, and at Viz, that's our number one value: patients first in everything that we do. Look, patients, because the time to treatment is reduced so significantly, we see a significant improvement in patient outcomes and a significant reduction in length of stay. So what that really means is a patient who maybe would have ended up in a nursing home can now get dressed in the morning, can go to work and go
Yeah.
about their day to day. So that's the thing I'm most proud of. For doctors, it's really an efficiency play, right? As a neurosurgeon, right, you wake up at 2 in the morning to review a case that someone's called you about. You want to know about the cases that you can intervene on, and you want to be able to respond and make a decision very quickly. We developed a mobile first platform that really works well with the EHRs, but in contrast to the EHRs, the electronic health records are kind of like the system of record. This is the system of action. It helps that specialist doctor communicate with the radiologist and take action on that patient to say to the emergency room physician, yes, let's transfer this patient and let's treat this patient. And so there's huge efficiency gains, which is so important today because clinical burnout is really a problem, right? There's more
Yeah.
and more treatments, there's more and more things to do, there's more people touching healthcare. And so we want to make doctors' lives better. And then there's the administrative side. And really that's about like how the healthcare over COVID has really struggled, right? There's been the increased costs of COVID, but also lots of staffing issues, meaning that a lot of hospital systems are struggling with their operating margins. And so they're looking for efficiencies. Now, if you get the right patient to the right place and you get the appropriate payment for that patient, you're able to actually have a more profitable service and put that into hiring more doctors and nurses to provide better care.
Yeah. So, you mentioned so many great things there. The first of which was, of course, the patient, not being in a nursing home, being at home, being able to do their thing. I mean, we were, blessed to be able to have constant care for my mom in her own home, but it was very expensive. It was very hard to pull off. I didn't want her to have to go to a nursing home, but she needed so much care because she, did not get that immediate help for her stroke. And I don't think it was the fault of the hospital. It was, just the system as it was. So, I mean, this is life saving, in so many ways that you're doing, so many different ways. One of the other things you said that I think is fascinating is that it's really it's really improving doctor care. It's improving and making more efficient the time that the doctors can spend with their patients, getting that doctor to the patient quicker. A lot of times when we hear about technology and we hear about the future of medicine, it's all about reducing uh, patient care in some way, shape, or form. At the end of the day, I mean, whether they say that or not, there is a lot of that. Less time with the patient, less care for the patient. Um, but this is really about the opposite, and that's extraordinary. Tell me a little bit about what made you do this and why you wanted to do this, because I mean it's incredible and it's beautiful. Obviously you're doing well financially for obvious reasons, but what made you want to do this?
So I remember one particular patient, and this is one of many, and every physician, every surgeon will have these stories. It was a young lady who was hit by a car, and she had a blow to the side of her head, and it had a bleed in the outside of the brain. It's called a acute subdural hemorrhage. And my job as the neurosurgeon was to make a big cut and remove the skull to relieve the pressure, because without that, the patient dies. And the reason I remember that lady so well is because the operation that we did went extremely well. We were proud of the team and very hopeful for her outcome. But 12 hours later, she was dead. And when we looked into the reasons why, it wasn't what had happened in the operating room. We managed to do the operation in around 30 minutes or so. It was the 4 to 5 hours of delay that had happened before. And so I realized that while I'd spent years and years focusing on getting better at these surgeries and the particular medicine around neurosurgery, if I really wanted to improve the system at large, I had to focus on the whole patient journey, the whole system, not the local part of what was happening in my OR. So I went out to this. I was British neurosurgeon, you can probably tell from my accent, and I went out to Stanford in 2014, which is a real center of innovation, both for technology like AI, but also for healthcare. There's a great program there called Biodesign that forces you to really look at all of the different steps of a patient journey to understand where things are breaking down and leading to poor outcomes than could do, so you can improve that. So I spent 2 years doing that postgraduate work there and realized with the advent of AI that not only could deep learning, one of the forms of AI that picks out patterns in data, not only could it tell the difference between a cat and a dog, but it could also detect clots in a patient brain or abnormalities on a patient's heart tracing, and do that automatically, the same at 2 a.m. as 2 p.m, same on a Sunday as a Friday. So you would remove the huge variation you see in healthcare by, which happens because of where the patient shows up, their socioeconomic background. You could take all of that out of it and you could just standardize the right pathway each and every time. And so we built a system that was not just AI, but is triggered by AI, but really was a whole workflow, what we call the system of action, to allow doctors to do their job more efficiently and more effectively. And it proved out in the numbers. In our first FDA study, not only did we save around 1 hour of time, we also found that the standard deviation, the measure of variation in care, went down from a response time of 120 minutes of variation to 7 minutes. So things were just happening more consistently because of technology trigger.
And when you talk about that consistency, you're not just talking about in that one hospital, right? But throughout the system, right?
Throughout the
Because
whole system. Yeah. I mean, we have a very exciting program on heart tracings in EKG or ECG, which are done very commonly, right? They're done in the primary care clinic, they're done in the ER, they're done all over. But there's a lot of information in there that can really only be picked out if you're a specialist cardiologist in that particular disease. And so what we're doing is across our 1,400 hospitals, which covers around 220 million lives, we're making it so that every piece of data can go through our platform. And if there's a particular disease, even though the patient's, not seeing a cardiologist, is out in the middle of nowhere, if they have a particular disease like hypertrophic cardiomyopathy or aortic stenosis, we will tell the specialists in the hospital system that there's a patient that needs their attention. And that population health thing, it really tries to increase access, right? It shouldn't just be because you're lucky that you showed up to the right place that you get good care,
Yeah,
and if
yeah.
you don't, because we all know that could easily be our relatives, right?
Yeah, absolutely. There's a democratization to that too, right? And an equalizing effect to that, right? I mean, if you're in a hospital in the middle of nowhere, now you can still have access to that incredible care. Or, I mean, it's unfortunate, but it's real, right? When we say, make sure you go to a hospital in a good area of town or whatever, right? Because you want to get the better doctors. I mean, that shouldn't have to be that way. And it sounds like you're laying the groundwork for solving that issue in a lot of ways as well.
Yeah, no, completely. It's really, really core to our mission, reducing healthcare disparities, making sure that rural areas or lower income areas get the
Yeah.
same level of attention as, your Stanfords or your Mount Sinai's of the world. One data point here is we know that thrombectomies and stroke are life-saving. And we found in one study that an underserved community, we doubled the number of thrombectomies and had a particularly strong 3x or 4x effect in the Latinx population.
Wow.
That was the population that, for whatever reason, was not getting transferred for these treatments as much.
Oh
And
my
so
God.
it's fascinating. The world of AI has really, which we've been living in and delivering on for the past 6-7 years, but it's really exploded into almost everybody's awareness because of what's happening with large language models like ChatGPT.
Yeah.
Right? AI works. It really does. It can understand data, whether it's imaging data or written data. But now people are talking about it a lot, and people are saying, well, oh my goodness, what about bias in AI? What about all the problems it's going to cause? And I agree, we need to solve for those. We need to have the right regulations in place. But we also have to realize the problems of the bias in human care and in how the world we live in today. And the technology actually done right can have a massive effect on equalizing, or as you rightly said, democratizing access to care. And that's what we're very much focused on here at Viz.
Yeah, that's it just outright incredible. Um, so we talked about strokes and whatnot, but I mean, you deal with some other medical issues as well with your with Viz AI, right?
Yes. Yeah, we started in stroke and we expanded into other neurological diseases, both acute things like trauma, but also diseases that were undetected or not appropriately got to the right place, like a brain aneurysm that's unruptured, that if not treated could kill you, right? So
Mhm.
incidental type work. We've expanded very heavily into cardiology and vascular, and
Okay.
we'll be moving into oncology as well. And so you can see all of the places we're picking. It's where there's real serious disease with serious consequence for the patient, but there's good treatments if you get the patient to the right place, at the right time. And so we've gone from probably the most acute disease, stroke, to now things like cardiomyopathy, where the average time to diagnosis is 2 years and fewer than 10% of patients get picked up, to now try and increase, we take that 2 years down to less than 2 weeks. And we hope we can get the diagnostic rate up to 80% or more. So there's a
Wow.
whole range of places we're working, but it's really got that. It's got to have those two characteristics. It's a serious disease that we can impact the patient outcome. And today, patients aren't getting the access they need, so we can actually make a difference.
And finally, I mean, you hear people all the time talk about the challenges of healthcare nowadays, and with insurance issues and everything else, and there's a lot of negative talk that goes on, and some of it, for good reasons. But it sounds like that you have a pretty hopeful perspective on things. Where do you see AI and in general how do you see the healthcare field in this country and the world, in the next few decades? I mean, it sounds like you have a hopeful perspective on what can happen.
Very helpful. Look, if you look at some of the amazing treatments that are coming down the pipe, like CRISPR, right, which has the potential to have an amazing impact on so many different diseases. Will we cure cancer? I think that's a very complicated question, because cancer is not one disease. We're going to make huge inroads, I think, to almost every disease that affects humans. The big problem we're trying to solve is making sure everyone gets to benefit from those treatments. So we're going to be the technology play that helps patients, no matter where they show up to healthcare, no matter how much they earn or the color of their skin, make sure they get the chance of getting access. We still need to make sure we're working on payment systems that allow both these innovations to be created and invented and taken through the FDA, but also allow no one to be left behind, so everybody actually gets access to them. But I'm very hopeful. We work very closely with the pharmaceutical industry, with the device industry, with providers and payers to tie all these things together, because if you have a disease and there's a drug that can treat you, you should be connected. There's no reason today with the technology we have why that can't be the case. It just needs to be implemented throughout the health system.
Well, that's a great and wonderful way to end off, and it sounds like you're going to be involved in a whole lot of that in a whole lot of ways, and we'll be sure to talk to you about it as much as we can, because it's so great what you're doing. So thank you, for what you're doing, and thanks for taking the time to talk to us today. We really appreciate it.
Chris, I really appreciate it. Thank you for having me.
Wonderful. Take care now.
Thank you.